liberate the people in the system, liberate the patient, liberate the doctor, liberate the hospital. What the liberation is the third-party payers have to stand back and let doctors and patients negotiate between themselves and find better answers. And we will never solve these problems with Washington trying to tell every doctor how to practice medicine, which is the direction which Washington's going at the moment.
My name is Michael. I had a question. When you spoke earlier about the income, the inflation rate of the healthcare doubling twice the rate of our income rate, are there any plans of action to actually, that you know of, to actually derail that from happening? Or, because you said they'd have to overhaul that before they even push this thing through.
Well, okay, did everybody hear him? Okay, well, healthcare is growing twice the rate of growth of our income, so, you know, what can we do about it? Okay. And what I meant when I said that Obamacare is going to have to change is you can't require people to buy something whose cost is going to grow twice the rate of growth of your income. What would you normally do if you're buying insurance and you didn't have a law to worry about? You'd go to a higher deductible, you'd take more limited benefits, you would adjust. That's what we all would do. But your ability to do that is going to be greatly limited under this new law. And so that's what I meant by the law is going to have to change. People are going to have a way out of that. They're going to have a way, at the minimum. I wish they'd go beyond that and free the market in the ways that we talked about. Yes, sir.
Yeah, what kind of incentives are you thinking about in getting entrepreneurs for increasing access to healthcare?
I suppose there's not a single problem in healthcare that's not being solved right now by some entrepreneur in the United States. The problem is that we have a huge bureaucratic system and they're not free to go out and take their ideas and change the system. So we have the perverse result that what most of the entrepreneurs are doing now is not making things better, but figuring out better ways for doctors and hospitals to maximize against the payment formulas of the government and the private employers and insurance companies. You can buy computer programs that tell you, when a patient comes to the hospital, do this, and get more money out of Medicare. Okay, that's what most entrepreneurs are doing. Well, we need to turn that around. We need to get them focused on solving problems, not creating them.
What kind of solutions do you see for Medicare Part B competitive bidding?
Does everybody hear that? No. The Medicare Part B is the new, you mean D, is what you mean, right?
Part B.
For Part B,
Competitive bidding.
which is for the doctor service.
Part B is for DME, durable medical equipment.
For major medical equipment?
Durable medical equipment.
Okay, all right. It's also for doctor service. That's what that is. Competitive bidding has the potential to lower our costs, and all competitive bidding means is you have a market, you have people competing with each other. It's working very, very well in the drug program. It could work much better in the license. Kind of technical question. But that's not where we're going to really solve the problem. We're going to really solve the problem is letting all the parts of Medicare, A, B, C, D, all those parts go over to the private sector. Let the private sector completely revamp the way they're paying for care. Giving seniors at least something as good as what non seniors do. An average senior is paying 3 premiums, 3 claims. Why is he doing that? Because Medicare is so lousy. And Medicare by itself doesn't pay for drugs. It leaves seniors exposed for catastrophic expenses. So the seniors go out and buy Medigap to protect themselves against the high bill. They buy a drug claim, that's the third premium to the third claim. None of you are paying 3 premiums for 3 claims. It's very, very wasteful.
My name is Chris Ford. You mentioned earlier about medical tourism. Is there like any countries that, I know you mentioned India, but for the most part, the United States is trying to break into the universal health care. Is there any like countries that you feel like it's going in the right directions as far as liberating the medical market?
Singapore has MediSave accounts, sort of like our health savings account. They first had them in 1984, way ahead of us. South Africa, under Mandela, liberated its health insurance market. It's the freest health insurance market in the whole world under Mandela. and a lot of American companies went. And the product that won was the health savings plan. And more than half of all private insurance in South Africa today is private, is medical savings plan. Switzerland has the most egalitarian system in the whole world. It's also predominantly private. People are forced to buy, they have a mandate, you have to buy private health insurance. You never ever hear the left talk about Switzerland, and I can't understand why they don't. Because it's more egalitarian than any other country, but it's private. That may be the reason. Those are my three favorite foreign insurance.
My name is Lance, and I have two small questions. One, we understand what needs to happen. What do the people need to do to see that happen? And also, best case scenario, how long until something could be put into place where it's fixed?
You already hearing? You know, I'm pessimistic about this because I was up talking to Congress about a month ago. I gave them a health contract with America, 5 things we ought to do, several volunteers. The Health Coalition, about 18 doctors, put it up on their website, so there's some interest in doing it the right way. But for the most part, Republicans are telling me all we want to do is repeal Obamacare. We're not interested in some replacement. They say repeal or replace. They're all committed to repeal and have no plans for fundamental change, which I find very discouraging. But the reason they don't is because you, the voters, aren't telling them that you want something different and better. And they're not ever going to do that unless they hear from their constituents that you want something better.
I just like to emphasize that fact that you just said they don't hear from us, the voter. So like, I've been like getting into politics more and more recently, and just going online and reading all the stuff that goes on in our government, and emailing just, I guess, an emphasis on being informed on what is going on in the government, and taking action by letting your senators and people of political power know how you feel about these different topics.
Second. Yeah.
Does Obamacare change Medicare Advantage at all?
Does everybody know what Medicare Advantage is?
I sold it for a season.
You all have heard President Obama and Joe Biden say the Republicans want to create vouchers in Medicare and how horrible this would be, right? Have you heard him say that? We already have vouchers in Medicare. It's called Medicare Advantage. Let's tell what this said. Medicare Advantage means that the federal government takes Medicare dollars and allows the senior to join a private plan that looks pretty much like the plan that probably most of you have. 1 out of every 4 seniors is done this, and they're very happy with their plan. And one of the worst things that Obamacare does is it cuts down the payment to those plans. So 1 out of every 2 seniors that's in one is probably going to lose this plan. And the administration is very fearful that it's going to alienate seniors. So it's trying to prop these plans up by giving them bonus money in the short run. But in the long run, it's going to cut the payments to them, and seniors are going to have less access.
And that you mentioned third-party payers having to step back. Why would you think they would step back, given that they have a vested interest in the system as it currently operates?
Well, what I mean by the insurance companies, employers, the government, I think they need to admit that they cannot dictate to the medical community. You know, doctors are smarter than insurance companies, executives sitting in some other city. So you tell the doctor, this is what we're going to pay you, and he's going to figure out how to get more money out of your formula. It's just, it's a losing battle. And so what the insurance company needs to do is say to the doctor, you want to be paid a different way, tell me how you want to be paid. We'll pay you differently if you save us money with the raise quality. That's the idea. Just like Jeffrey Graham. Let him be a millionaire. If he's saving the rest of the $10 million, let him keep a million. And then let's encourage every other doctor to think the same way.
But insurance companies right now are doing very well. Okay, so the question becomes is, I don't see their incentive. I mean, I agree with what you're saying.
Part of it is they're about to get squeezed
Any last questions? This is your chance.